Hey, I'm Laura. I'm an OT from Calvary Transitional Aged Care, or TACP. So we're a program that focuses on the rehab of clients in their home and assists them in transitioning from hospital to home. We're an MDT that is made up of physios, OTs, nurses, social workers, speech pathologists, dietitians, podiatrists and allied health assistants. So we have a big focus on optimising our clients' function and safety within the home environment, re-engaging them in goals that are meaningful to them. So that's anything from basic ADL tasks to re-engaging them in community access activities if that's what they're interested in. We also have a big focus on case management, so that's setting them up with appropriate services, future planning, as well as linking them in with the appropriate supports to ensure that they're as safe as possible on discharge. So in light of COVID-19, all the disciplines have had to adapt to the changes in relation to this. In this video, we'll go through how some of those changes play out in our work.
Hi, I'm Holly. I'm one of 4 physiotherapists in TACS, and how we've changed our delivery during COVID times. We're doing more telehealth sort of stuff, home exercise programs around maximising function and safety in the home and prevent deconditioning, socially distanced outdoor mobility, and utilising family and carers more in the community access of patients.
Hi, I'm Sally from the TACS admin team. Just discussing the changes in the team with COVID-19. I would say regarding admin role, there is not a great deal of changes. It's probably just maintaining social distancing around the office and just hand hygiene, just supporting the rest of the clinicians in the team, I guess, answering any queries the clients might have if they call in to ask about how things will go on their visits. But basically that's how things are working for the admin team.
Hi, my name's Rebecca. I'm one of the social workers in the TACS team, and as part of COVID-19 we've had to change the way that we practice slightly. We formed connections with local businesses and services to refer our patients to because they've been quite socially isolated because of the coronavirus. We've been referring people to home visiting libraries, to the local restaurants for food, and we've been keeping up our visits to make sure that they're still getting to talk to people.
My name's Jess. I work in the Calvary TACS team as an AHA. I also work with another AHA. Due to the COVID-19 situation, the AHAs have had to change our way on approaching clients. So by this we're going to, for example, our PTs, OTs or speech path, and seeing what kind of ways they want ADLs or their physical activity approached to these clients. With the ADL retraining, we're trying to get the clients more independent. For example, personal care, trying to get them to be as more independent as possible, relieving carer stress. With PTs, we're trying to do more exercises with them, but in terms of social distancing, really clearly explaining how they're meant to do that safely and appropriately. With PTs, outdoor mobility as well, getting the clients still the sense of fresh air and sunlight, and in terms of just getting their mood up and being outside. Because we're seeing these clients regularly, we're able to build a rapport and foundation with these clients, so we're able to do more disciplines in the one session, so meaning less visits, but more able to connect with the different health professionals and see what they want, but put it all into maybe on one session. With all this information that we get from the clients, trying to relay that to the allied health professionals and the case managers to make sure that the clients are getting the best support during this whole situation.
Hi, I'm Anika. I'm the speech pathologist in the TACS team. So some of the ways that we've been managing the COVID-19 situation is through making screening phone calls. All staff members have been making phone calls to clients on the morning of every day they go to visit clients, just to ensure maximum safety for staff and clients and to ensure they haven't had contact with people with COVID or have new developed symptoms overnight. We've also been doing screening of clients prior to doing home visits to ensure that the home visits are absolutely necessary, and just making sure that we can maximise safety for all our clients and staff. We've been practising social distancing whilst on home visits, doing things like having some of our sessions outside the client's home, so sitting in the garden, just to assist with managing to maintain that social distance, and also to provide some different settings to the usual for our clients.
Hey, I'm Laura. I'm one of 4 OTs that work for the TACS department at Calvary. So the way that service provision has changed for us in light of COVID-19. So to ensure that basic ADLs are being met, we are focusing on retraining both the clients, the carers, and engaging our allied health assistants in with therapy. We are doing a lot of self-care assessments, meal prep assessments, stressing retraining, and again, a lot of carer retraining. And by only engaging, the family, the therapist, and our allied health assistants, that reduces the amount of people that are going in and out of the client's house, where previously we would have had services going in to provide that care. And by structuring therapy in this way, it also, promotes that independence for the long term. So previously, a lot of the meaningful activities for our clients were structured around community access, engagement in different social groups, which due to the restrictions placed because of COVID-19, we're not able to complete. So we're having to find a lot more meaningful activities within the home environment. Some things I've been doing with my clients is gardening, redoing the garden beds. One of my clients post-stroke, we've raised the garden beds to promote ease of access and to increase her safety. One thing that really hasn't changed is equipment prescription. We're really lucky at Calvary to have a really extensive equipment loan pool which clients are able to utilise throughout their time on TACS.
Hi, my name's Mary. I'm one of the nurses working in TACS. How did we contribute to COVID-19? Well, we attempted to try to keep the clients safe at home by attending more home visits, assessing for any deterioration, liaising with the GPs, and trying to keep the patients out of the medical centre, clinics and the hospital. We were very vigilant with our PPE by ensuring appropriate use. Before attending home visits, we would attend to the COVID-19 screening, home risk assessment to keep staff and our clients safe.
Okay, bit lower, higher. Now to the left. Perfect. Calvary.